It's possible that people of different races and ethnicities will show different symptoms of depression. People and their healthcare experts can improve their ability to diagnose and treat the ailment if they have a better understanding of these variances. The first step towards healing and getting better is often coming to terms with whether or not the persistently negative sensations are the result of depression. If you recognize any of these warning signs, it may be time to consult with a mental health specialist. Before starting the video, please do not forget to like, share, subscribe, and press the bell icon. 1. Hopeless outlook. People who suffer from depression frequently experience thoughts of hopelessness, although the prevalence of these emotions does not remain consistent across all racial and ethnic groups. According to the most current National Health Interview Survey, individuals who identify as Hispanic or Latino are the ones most likely to report feeling hopeless, all or most of the time, followed by individuals who identify as having 2 or more races. People who are sad may experience feelings of worthlessness at various points in their lives. The survey indicated that people of 2 or more races, along with American Indians and Alaska Natives, are the most likely to have these feelings. Individuals who identify as Black or African American are most likely to feel that everything is an effort, all the time, followed by individuals who identify as Native Hawaiian or Pacific Islander. There is a correlation between having depression and experiencing unwarranted feelings of guilt. It's possible that they frequently think things like, "It's all my fault," or "What's the point?" More than 1 million persons who screened themselves on the website of Mental Health America in 2020 for depression and anxiety stated that feelings of loneliness and isolation were among the top 3 reasons they described themselves as having poor mental health. It was cited as the primary reason for the prevalence of mental health problems among Hispanic and Latinx people. 2. A diminishing of interest. People who are depressed may find that the things they love no longer bring them pleasure or delight. It is common for significant depression to be accompanied by symptoms such as a lack of interest in, or withdrawal from, activities that were previously looked forward to, such as going out with friends, participating in a hobby, or playing sports. According to Mental Health America, a staggering 90% of people who identified with more than one race reported having symptoms of depression in the year 2020. 3. An increase in tiredness and difficulties sleeping. People who live with depression may experience extreme fatigue, which is one of the reasons why they may cease engaging in activities that bring them joy. Depression is frequently accompanied with a lack of energy as well as an overpowering feeling of exhaustion, both of which can be among the most incapacitating symptoms of the condition. This can cause one to sleep for longer than necessary. Individuals of Asian and Pacific Islander descent, particularly those of older age groups, may report feeling tired or sleepy rather than depressed, as the latter can be perceived as less culturally acceptable. This is especially true for older individuals. As a result of the fact that these symptoms might be ascribed to a variety of illnesses, including chronic fatigue syndrome, medical practitioners may fail to identify the actual reason. Insomnia and depression are linked to each other, and the 2 conditions can feed off of each other. Anxiety is a common side effect of not getting enough rest. 4. Nervousness. Both depression and anxiety frequently arise hand in hand. Examples of symptoms of anxiety include the following: thoughts of danger, worry, or dread, quick heart rate, rapid breathing, increased or heavy perspiration, shaking or muscle twitching, difficulty focusing or thinking effectively about anything other than one major preoccupation. 5. Irritability in men, particularly. Depression can have very diverse effects on men and women. According to research, males who suffer from depression are more likely to exhibit symptoms such as irritation, hazardous or escapist behavior, substance addiction, or misplaced rage. 6. Alterations in one's appetite as well as one's weight. People who have depression may experience shifts in both their weight and their appetite. It's possible that each person will have a unique experience with this. Others won't feel hungry at all and will be able to shed pounds, while others will have an increased appetite and put on weight as a result. Whether or not dietary changes are done on purpose can be seen as an indication of whether or not they are related to depression. In the event that this is not the case, it is possible that the symptoms are the result of depression. 7. Uncontrollable emotions. The next thing you know, it's a full-blown fit of rage. The next thing you know, Uncontrollable tears are streaming down your face. Depression can cause a person's mood to swing wildly, and it has little to do with anything else going on in the world besides the individual experiencing the swings in mood. Like, share, subscribe, comment.